Board of Supervisors meeting. Will you please join us in the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Roll call, please.
Supervisor Pine. Here. Supervisor Horsley.
Here.
Supervisor Slocum. Here. Supervisor Tissier.
Here.
President Groom.
Present. Thank you. Now is the time for public comment for items that are on the consent calendar or not on the regular agenda. Martin Fox.
Good morning, President Groom, members of the board, my fellow veterans, Supervisor Slocum and Mr. Balpe, and County Council Mr. Byers. Thank you for your service to the county. Please vote to implement Laura's Law now and bring hope to family members of persons living with serious mental illness, because it is compassionate, cost-effective civil proceeding that provides treatment to those incapable of consenting to treatment due to the nature of their illness, without having to endanger them, our psychiatric emergency and inpatient nurses, or our law enforcement officers. Laura's Law gives the seriously mentally ill an opportunity to recover, live productive lives, and escape the revolving door of mental hospitals, jails, and the streets. The anniversary of Errol Chang's death in Pacifica takes place tomorrow. Now everyone knows that Errol Chang sought treatment, and he was refused treatment because he was not sick enough. The sad truth is that Errol Chang is not the only person deemed not sick enough to receive treatment. A county psychiatric managing nurse told a family member of a person living with mental illness who was incapable of consenting to treatment that their loved one would have to get a lot worse before he could get treatment during a mental health board meeting in Pacifica in July of 2010. The responsibility of creating the circumstances that led to Errol Chang's death and the injuries and deaths of others like him will continue to fall on San Mateo County's taxpayers as long as the health system's mental wellness regime helps perpetuate the immoral and inhumane policies and procedures that denied him and others like him the treatment they need to recover. Please vote to either waive the health system's line of impeach to short act civil and criminal immunities or join Los Angeles County, Orange County, Costa County, Placer County, Mendocino County, Yolo County, Nevada County, and even San Francisco by voting to implement Laura's Law. Thank you.
Thank you, Mr. Fox. Catherine O'Malley.
Good morning. Heilig Patrick's Day. I am concerned about something very much so. We have a dilemma, of course, with international security and San Bruno City of allowing fireworks sales and the explosion thereof. I am here over concern for firewalls, as it were, and the ability to confide in our keyboards to maintain security at the utmost level, please. Medical files, the protection thereof is utmost #1 priority, please. And if it is not followed, so much as a vapor pen coming into the building could ignite a problem. That is the premise I have worked on. That is the platform I am working on. I am not on a podium. I'm at a microphone on an airwave that is reaching people we do not know. Because of this situation, I ask you to allow me to keep silent at a certain given point. I have 45 seconds remaining. I will not shoot my mouth off. Is there a doctor in the house? I'm serious. Is there an MD sitting in this room? I rest my case.
Thank you, Ms. O'Malley. William Henshaw.
Morning. Nice to see all of you today. In the package you have received, you will find powerful, unopposed evidence which includes the following concessions from the California Supreme Court, Assembly, and other government sources. 1. Writ of habeas corpus has been suspended, perhaps in perpetuity. 2. The judicial courts have been closed in like manner, yet there is no known declared state of rebellion or invasion which might justify these acts. 3. That California is not a state admitted into this union, plain violation of Article 4, Section 3 of the Constitution of the United States. 4. There is no Republican form of government in California, a plain violation of Article 4, Section 4. 5. No right to trial by jury. 6. No right to assistance of counsel, no right to appeal. Pursuant to these facts, there seems to be no evidence that you were duly elected or appointed, and there is no lawful government in California at the present time. Accordingly, I would be much obliged after you review the materials if you could produce any evidence that supports your lawful enjoyment of your offices here. And this would include, since California is a territory, an act by Congress authorizing an election in the territory of California and or appointment to your offices by the President of the United States, Article 2, Section 2, Paragraph 2. I have found no evidence of the former, and the office of President at the moment, and for quite some time, has been currently vacant, and for far more reasons than are bandied about on the internet these days. Thank you.
Thank you, Mr. Henshaw. Adrian?
Good morning, Council. I'm here based on the subject.
Could you say your name, please?
Oh, Adrian. Adrian Arceo. Sorry. I'm here because on the subject of establishment of no parking at 2920 Flood Avenue, I'm basically asking for you guys to reopen the issue because we own a small family business there. And if we put no parking, we have no place for our customers to park. And that affects our family business into paying taxes as well. And I'm not completely sure on how that would benefit our community. I mean, based on no parking, I have a 15-minute parking zone in front of my building, and they don't enforce that. So I was just wondering or asking if you guys are willing to open or reopen the issue. Thank you.
Thank you. Mr. Manager, could you perhaps have the Public Works Director look into this? Thank you. That concludes the public comment section for this morning. So now we'll go to the setting of the agenda.
Move to set the agenda and to approve the consent agenda items.
Second.
All in favor?
Aye.
Aye.
Thank you. Our first item today is a bittersweet one. Brian Zamora is retiring after a very long, productive run here at the county, and we wanted to recognize him with a little farewell. And I'll summarize this, but Brian's graduated from the University of New Mexico with a degree in biology, from the University of Minnesota with a master's of public health, and obtained certification as registered environmental health specialist. He served as the assistant director of environmental health in Santa Barbara before he came to San Mateo County, where he became the director of public health in 1995. He has been the community health director in 2004 and heading many programs such as public health, emergency medical services, chronic disease, and injury prevention. He became the director of family health services in 2011, partnering with key family health leaders to implement the electronic health record system, partnering with the health plan of San Mateo to become the only county in the state of California to pilot California Children's Services to eligible enrollees. So during his time here, he has been known as a great leader, a great producer, very creative and very innovative, and has also served San Mateo community quite well. He's a member of the Leadership San Mateo Burlingame Foster City Hillsborough Board of Directors. And personally, he is my basketball guru. And as we enter March Madness, I don't know what I'm going to do without you, Brian. So we've got this. Would you all like to say something before I present this?
Sure, I'd even make a motion for
Okay.
that resolution.
And I'll even second.
Okay. All in favor?
Aye.
I'd just like to say, I knew Brian before I even got here to the county because I worked in land use for many years, and there was many a dirty site that people were looking at to develop on. And so even back then, an outsider working with the county, he was always very graceful, very caring about the subject matter, and very thorough in the work that he did. So I appreciate your great work here at the county and all you've done for the residents of the greater Bay Area.
I might add that, I've worked with you extensively, and every time I've worked with a different part of the health department, I've always found you running it. So, so you are a man of many talents, obviously, and I've really enjoyed working with you. I'm really, I guess I'm glad to see you go. In a sense, I'm glad that you're going to go on to a new chapter of your life, and I think that's wonderful for you and your wife. But I'm sad to see you go because I think you're a really competent manager and you're fun to work with. So we're sorry to see you go, but wish you the best in retirement.
Well, Brian, I haven't had the good fortune to work with you for as long as Supervisor Horsley.
I have been around a long time.
Probably nobody has. That's true, Supervisor.
Yeah.
But our most recent meeting together, I think, was at the Domestic Violence Council, and I have to say that you along with Mike Callahy did a stellar job on getting our bylaws in order and making sense out of that process. And I just wanted to thank you for your contributions to the county and to the people of San Mateo County. And I'm very curious to know what this next chapter of your life holds for you, your wife, and your family. So when it's your turn to speak, if you could just give us a little update on plans, and be sure to leave us your phone number and email address, and we'll be fine. So thank you, Brian.
And I'll just add a big thank you as well. And, there are thousands of people in our community who've helped along the way. And I know they'd give you a big thank you, too, if they were here this morning.
Through the president, members of the board, Ms. Ferralis, Mr. Malby, Mr. Byers, I have a few words, but first I'd like you to meet my wife, Kit. Some of you had, so. It's been quite a journey. This concludes 41 years in public service, and I saved the best for last, 27 years in San Mateo County. But I would be remiss if I didn't share this recognition with some key people. First, my staff, managers, who on a daily basis provide the services that our clients deserve. Margaret Taylor, who hired me in 1988, mentored me and taught me the San Mateo County way, which is to collaborate and cooperate with everyone. Last but not least, Dr. Scott Morrow, who partnered on many a public health campaign over the years. But in those 27 years, there has been a lot of change. But the one constant over that time has been the extraordinary leadership and governance by the Board of Supervisors. And the county employees, the citizens of the county, can always be thankful that no matter the financial issues, the political issues, that we have a Board of Supervisors that's solid on their side. So thank you very much.
want to thank you for the huge amount of work that you have done for this county. Thank you, Brian. Now we'll go to item number 2, which is a presentation of a proclamation designating March 2015 as Women's History Month. And we'll also include a presentation on the 2014 annual report by the Commission on the Status of Women. So I'll make the motion, Adrian,
I might even second that for you.
to approve this proclamation honoring Women's History Month. And all in favor?
Aye.
So Women's History Month is an opportunity to recognize the multifaceted role of women in society and to reaffirm a commitment for greater equality for women. San Mateo County strives to address this issue with many programs supporting and encouraging women in their efforts toward advancements in their careers and home life. I want to point out that there's a women's art show this week or this month in the Caldwell Gallery, and Friday evening is our annual Hall of Fame event that will be held at Kenyatta College in Redwood City. So now I want to present this to Chairman Gann and Linda Kelling, and I can't see that far, and Honora Miller is with us, and other members of the Women's Commission. So let me give this all to you.
Before I start, I'd like to say I had the incredibly daunting task of keeping my dress clean this morning. I have a golden retriever and a 3-year-old daughter. It was crazy. Good morning, President Groom, honorable members of the board, Mr. Maltby and Mr. Byers. My name is Carrie Gann, and I'm the president of the Commission on the Status of Women. I would like to acknowledge the other members of the commission, Linda Kelling, Tanisha, Becky Abens, and our director, Honora Miller. On behalf of the Commission on the Status of Women, I would like to thank you for proclaiming March as Women's History Month. Proclamations such as these create opportunities to acknowledge the past and present accomplishments of women, along with the struggles for equality that have continued to be waged. I would like to take a few brief minutes to update you on the current work of the Commission on the Status of Women that we have undertaken in the past year. Our current focus areas are women's political leadership development, including a gender analysis of county boards and commissions, advocacy related to human trafficking and women's criminal justice issues, legislative analyses, and recognitions of women's accomplishments through the Women's Hall of Fame and Young Women of Excellence Awards. The Commission has been keeping actively informed about the diverse needs of women of all ages in San Mateo County and making recommendations on specific ways to meet those needs since it was established in 1982. The Commission also honors the achievements of women through the Women's Hall of Fame, which is now in its 31st year. Over the past several years, the Commission has focused some energy on encouraging women to become involved politically and has worked collaboratively with an organization called Women's Political Leadership Network on appointment training and network opportunities. We recently co-sponsored an appointments training with them to encourage women to seek positions on boards and commissions. We also co-sponsored a women's equality mixer for elected women in August. The Commission's interest in women's political involvement led to an ongoing gender analysis of county boards and commissions, which is now in its 3rd year. That provides information on the nature of participation by women on county boards and commissions. That analysis is underway, and a report will be forthcoming later this spring. For the 5th year, the Commission conducted a clothing drive in early 2014 for women's work attire with county employees. The clothing was donated to the Career Closet, a nonprofit that assists women who are entering and re-entering the workforce. More than 150 county employees donated gently used and some new clothing, shoes, and accessories. Although the Career Closet has since closed its doors, the Commission is seeking another nonprofit partner so that it may resume the clothing drive. In addition to keeping aware of the needs of the inmates at the Women's Correctional Center and attending jail planning meetings for the Maple Street facility, the Commission's Women's Jail Work Group has recently completed recommendations for gender-responsive programming at the news facility, which will be shared with the Sheriff's Office Jail Planning Unit. The Commission has also been learning about the growing issue of human trafficking, connecting with organizations that are engaged in local coordinated response, and developing a plan to raise public awareness. In January, we co-sponsored, along with local clergies, the screening of a documentary about domestic sex trafficking called In Plain Sight, and will continue to engage in activity to raise awareness about human trafficking. As we learn more about the needs of trafficking victims, we will return to you guys with recommendations. The Commission on the Status of Women is once again collaborating with the Arts Commission during Women's History Month to hold a women's art exhibit here in the Hall of Justice. We hope that you will take a few moments during this month to enjoy the work on display at the Caldwell Gallery and on the lower level as well. We have continued to develop the permanent Women's Hall of Fame exhibit at the San Mateo County History Museum. The exhibit features each of the 284 honorees in a searchable iPad-driven kiosk, including photos, bios, areas of focus, and a historical timeline that provides context for the honoree achievements. In the future, recordings of acceptance speeches will be added to the exhibit, and an oral history project will be undertaken. We encourage members of the public to check it out at the museum, where it is available for year-round viewing. As I wrap up this report, I'd like to take the opportunity to invite each of you and everyone present or viewing this meeting to the 31st Annual Women's Hall of Fame. My daughter and golden retriever will not be there, so please come. It is safe. It is Friday. This Friday, March 20th, 5:30. It's located at Kenyatta College at the Grove Building, where we will induct Sister Christina Heltzley. She is the director of the St. Francis Center in the North Fair Oaks neighborhood in Redwood City. Kellix Nelson, executive director of the San Mateo County Resource Conservation District, and Mary C. Pappas, a leader and advocate for services to support the graceful aging of older adults. And high school senior Beverlyn Law will also be inducted as our Young Woman of Excellence. Tickets can still be purchased at brownpapertickets.com. Information is available on the Commission website, csw.smcgov.org. Thank you for your ongoing support of the Commission on the Status of Women. We welcome feedback and ideas on how the Commission may assist you with issues that may arise. Thank you.
Thank you for your great leadership, and to all of the members of the Women's Commission who are here today, thank you for all the good work you do, not just in the month of March, but every month of the year. So we voted for that one, didn't you? Yes. Okay. Item number 3 is a presentation of report on analysis of the Homeless System Performance Human Services Agency. Ileana, welcome.
There we go. Good morning, President Groom, honorable members of the board, Mr. Malpe, Mr. Byers, Ms. Perales. I'm Ileana Rodriguez with the Human Services Agency, and I'm here today to provide you with a summary of the Homeless Management Information System analysis, which was requested by your board last year. Last July, your board held a study session on homelessness. Staff made presentations on the current efforts underway in the county to address homelessness and the current Housing and Urban Development Department's policies and priorities, in addition to some best practices nationwide. Your board instructed the Human Services Agency to conduct an analysis of our Homeless Management Information System, commonly known as HMIS. The Human Services Agency issued an RFP late last summer and hired Focus Strategies to conduct the analysis of our HMIS data. A report has been provided and developed. This morning, we're prepared to share the results of the analysis, provide background on our shelter, temporary housing systems, information on the performance of our programs, possible implications for our system, which can inform the creation of the new or revised HOPE 10-year plan. Overall, the county has committed over $6 million in funding annually to the Center for Homelessness. These funds go to our core agencies, our HOT teams, housing assistance, homeless prevention services, and our emergency and transitional housing programs. In addition, we have $7.5 million from federal housing urban development continuum of care grants, which are distributed directly through us to the providers. Through your investments, you continue to demonstrate a steadfast commitment to end homelessness in San Mateo County. With me today is Megan Kurdoff-Schatz. Megan is a principal of Focus Strategies and has extensive experience in planning and evaluation of homelessness programs and systems. Based in Sacramento, California, Focus Strategies maintains a broad clientele on a national level. Megan has served as the Housing California Homeless Policy Director and as the Alameda County-wide Homeless Continuum of Care Coordinator. I would like to turn over the podium to Megan, who will walk you through the findings.
Thanks, Ileana. Good morning, Madam President, members of the board. Thank you very much for the opportunity to be here today. All right. So as Ileana said, I'm with Focus Strategies, and what we do is we help communities and states to understand how they're performing in terms of reducing homelessness. We do that primarily by helping communities and states use their local data to understand what you're doing now, what it's achieving, and then look at what some alternatives might be. So before I get into the results of this particular analysis, I wanted to take a moment to talk about what I understand you are trying to get to. I've heard a lot about the commitment of this board and this county to reducing and ending homelessness. So I thought it would be useful to start with a frame for what's a system that could help you get there. So a system that really ends homelessness, so aggressively reduces homelessness, actually diverts people from becoming homeless in the first place, right? Prevents people from entering homelessness. It means that people are quickly engaged in the least expensive solution to that household's homelessness. That once people enter the homeless system and enter homeless programs, they stay the shortest possible amount of time so you can turn those beds and resources over to the next household. And of course, that when people exit programs, they are leaving to permanent housing. They are leaving homelessness, so you're seeing homelessness decline. Of course, the only way to get there is to be extremely cost effective because presumably there aren't unlimited resources to work on homelessness, so you have to have really cost effective solutions. In order to get there, of course, you need good quality data so that you can achieve the kind of continuous improvement and understanding of how you're doing now and what you could be doing differently. So as Ileana mentioned, we responded to this RFP and were selected to produce this report. And the purpose of the report was to tell you who is being served in your homeless system now, what are you accomplishing in your existing homeless system, and how are your funds actually being invested. We collected a lot of local data, primarily from your Homeless Management Information System, or HMIS. We collected local program budget data, so that's from all budget sources for programs that are serving specifically homeless households, that's singles and families. And we did this across program types, and the types that were included in the analysis include emergency shelter, transitional housing, rapid rehousing, and permanent supportive housing, which are all different models, different interventions that are used in this community and in most communities. Then we uploaded the data into an Excel-based tool where we actually looked at the performance across programs and across different intervention types, and we combined that HMIS data and program budget information along with your homeless population data to really understand how you're performing. So most of what I'm going to talk about this morning is about those results. And basically, these different metrics, these are the key results in the report that are listed on the slide. This is really about how your programs are serving people now, what that looks like dynamically, and whether or not people are returning to homelessness. Okay, so this pie chart is just a simple chart showing you the population as of the 2013 homeless point in time count. You can see that the majority of the population, just over 1,200 people in this particular count, were unsheltered. That means they're sleeping outside, right? The orange slice is showing people who are sheltered, so that's emergency shelter and transitional housing. These are all of these terms are defined by the federal government. We use those definitions because you certainly use that source. And then the gray slice is people in institutions and people who identified as homeless who are in institutions. So you can see that most people in the point in time count are unsheltered. So within that population, the homeless population overall, this slide is showing where homeless households are actually chronically homeless versus other homeless. So chronically homeless means they've been homeless a long time and have at least one qualifying disability. So again, you can see here that the majority of the population is single adults, right, which is highly correlated with people who are unsheltered, which would make sense, right? Not a whole lot, thankfully, of unsheltered families. And you actually proportionally have a very small number of homeless families. Okay, this might be a little far away for some of you, but hopefully all of you can see this slide. What this is showing is the relationship between who is homeless, that's the population, where your capacity is, that means where your inventory is, the beds and units where you're actually serving people who are homeless, and then the investment, the dollars. So this sort of stair steps that you can see is showing that you have a lower proportional investment on the adult side in terms of the money and the capacity relative to the population. And on the family side, it's the opposite. It's probably worth noting that nationally, this is very typical. This is very typical. Okay. So within, well, let me go back just a second and say, of course, as you're looking to reduce homelessness more, one of the things to always think about is where are we being really cost effective, right? So that every household we can get housed, and we're turning beds over and exiting people to permanent housing quickly, so that the next family, the next single in line has the opportunity to come in. So this is not saying, sometimes people take this kind of slide to mean you should take all the money from the single side and put it in the adult side. And there may be some proportional truth to that at some point in time, but mostly what it's saying is you could be more cost effective. Okay. So one of our other key findings is around bed and unit utilization. So this data is from HMIS, and what it is showing is the utilization by program type. So basically what this is saying is that you have some utilization concerns. You're underutilizing across all of these program types. So rapid rehousing as a program type is not included in this chart because there isn't a fixed inventory, so you don't think about utilization like filling the beds. That calculation is different than emergency shelter, transitional housing, and permanent supportive housing. It's really important to note that if you're underutilizing your system, of course, there are other people, for example, sleeping outside or in cars who don't have who aren't getting in right now, and there may be some opportunity to work on that. Within your permanent supportive housing, even that is a bit low here in San Mateo County, that utilization rate, and that is likely related to adequate case management services and the ability to do housing location services quickly. So for the other program types, we think that that's a significant concern. We'll also say that HSA has this data and information at a program level, and they are able and will be working on that. Okay. So this slide is showing entries from homelessness. So basically, what you sort of want to see is you want to see that people who are entering homeless programs are homeless, right? If you have a high percentage of people entering from housed locations, it suggests, which you do here, all of the pink and red, about 44%, this is 44% of entries into emergency shelters are actually from housed locations. So that, for example, could be people who are doubled up and are calling every day trying to find a shelter bed, that kind of thing. Also institutions, you see 9%. There's various different locations. The thing about the pinks and the reds are those are households who could be diverted from ever entering homelessness. So you have a whole 44% of your shelter bed capacity. It's very similar on the transitional housing side. That if you were to really invest in a diversion approach, then before those folks enter the system, you could actually house or rehouse them quickly, which is much more cost effective. And then your beds on the homeless, in the homeless system wouldn't be taken up by people who have lower needs, right? The people who are actually able and have been able to maintain housing. Okay. So let's talk a little bit about rate of exit to permanent housing. So the purpose of this slide is to show you how each program type in your community is performing. So this excludes permanent supportive housing because permanent housing is in fact permanent housing, and so we're not looking for those folks to exit, right? Generally, permanent supportive housing is serving people who have disabilities, were homeless for a very long time. So once they're in supportive housing, that's good, that's a successful exit. For these other program types, what we want to see is that people come and stay in the program, and then that when they leave, they're in permanent housing. So their homelessness is ended. You had a success. You see here that emergency shelter rates of exiting people to permanent housing are extremely low. That's very typical. Emergency shelter, of course, provides two purposes. It is an emergency response, so you're not going to expect your emergency shelters to have really high rates of exit to permanent housing. However, these are a bit low, and we could talk about some ways that more people could exit from shelter directly to permanent housing. And then, of course, you have transitional housing. Transitional housing is typically, a certain amount length of stay, might be 6 months, it might be a year or whatever. And then people, it's like temporary housing, and then people are supposed to leave to permanent housing. I think it's important to note that the federal standard for exits from transitional housing to permanent housing is 65%, which you're meeting here on the family side, but not on the single adult side. And those rates in general are really low when you think about, also not atypical nationally, but when you think about the point of transitional housing programs is to exit people to permanent housing, and you see those kinds of rates, and we'll talk in a minute about the money that's being spent on that. But that's a concern, especially clearly on the single adult side here. And then finally, rapid rehousing, you see extremely high rates, very good success exits to permanent housing, which is also nationally very typical to see that level of success. So rapid rehousing as an intervention type basically has been used for a variety of different household types. Most of the studies and program evaluations that have been done have been on families. But there are a lot of program evaluations as well, particularly from HPRP, which is the Homeless Prevention and it was a federal stimulus money that was spent. It was about $1 billion that was spent on quickly rehousing people in a rapid rehousing program. The acronym's going to come to me any second. And that was across the country, and there's really good results. Certain communities really targeted both single adults and families and saw great success. Some communities, including Sacramento, included chronically homeless people with rapid rehousing, which is short-term rental assistance. And had great success. And generally, this model is people come into shelters and they're exited very quickly into a permanent unit with a lease in their own name out in the community, and then you see the kinds of results that we just talked about. Okay. So here's a key point around cost in your community. So the 3 bars on the left are showing you the cost per permanent housing exit. So this is for all exits. This is just to serve the households that you're serving, right? So it costs, for example, for adults, single adults, it costs $14,314 to have a successful exit to permanent housing in transitional housing, right? That goes down to $78.80 for rapid rehousing. On the family side, you can see shelter looks incredibly expensive, huh? With $25,000 per successful exit to permanent housing. That's basically because not very many families who enter shelter are exiting to permanent housing. So that's something to be worked on. But at the same time, shelter is an emergency response, and so you don't always expect to see really high rates. However, I will point to the $18,000 for the family households exiting people to permanent housing. That's per household, as compared to rapid rehousing, which in your community costs about $4,200 for a success. So pretty significant results. A lot of times people will say, okay, but then what happens to people in rapid rehousing? We're going to house them somewhere, and then they're not going to be able to make it. They won't be able to pay the rent, right? So how can we call that a success? So we look to see, do they enter homelessness again? Do they return to homelessness? And as it turns out, in this community, one really significant result is that your rates of return to homelessness on rapid rehousing match the national experience, but are far higher for transitional housing. So the transitional housing programs that are more expensive also see much higher rates of return to homelessness. Okay, so now I'll just talk a little bit about what these, how these results relate to what you might want to do going forward. So the first thing, and from the analyst's perspective, a great thing is you actually have the data that you need to assess system performance. So your data quality is reasonable to very good, and you certainly have the information needed to use it in a strategic way like this. Your existing bed inventory is underutilized. That's certainly something that could be improved upon and looked into, which I know HSA is working on. And you have a lot of non-homeless people entering the system, and as soon as they enter the system, by definition, they're homeless, right? So if you can really have a comprehensive diversion approach, it would be a very inexpensive way to move all of those folks into new housing or keep them in the housing they're in, and really use the resources you have for the people who've been homeless the longest and have the highest needs. And if you'll remember some of the slides I showed in the beginning about who your homeless population actually is, you have a lot of unsheltered singles who don't have a way into the system right now. And with these kinds of shifts, you could really move that along and move people into programs and then out into permanent housing. Okay, and your exit rates to permanent housing, again, are low in shelter and also fairly low in transitional housing, especially on the single adult side. Your rapid rehousing programs are performing with excellence, and they're very cost effective. And their rates of return are low. And with that, I'm going to turn it back to Ileana.
So the implications of these findings point to a number of ways we can strategically redesign our program and potentially shift some of the investments to serve more homeless people in our communities. One is the diversion of individuals, stopping them from coming into the system and becoming homeless by providing some investments to stabilize them or keep them where they're housed. Another is to quickly engage people to end their homelessness. If someone's homeless and living outdoors or in vehicles, we could provide a program that works quickly to return them to a housed situation. You heard earlier that the data demonstrates that our existing rapid rehousing program, and I was surprised that our partners are starting to delve into this arena, outperformed our shelter and transitional housing on all key metrics. We can look at ways to pilot more rapid rehousing programs for single adults and families with children through Measure A funding. However, we need to also increase our inventory of units available. The bottom line is we need more affordable housing units. Programs to end homelessness can work closely when there are places to place them or work effectively. Maximizing permanent supportive housing for the chronically homeless, and I think our Director of Housing, Mr. Lowell, will address this issue more in depth this afternoon. But our county has a large number of chronically homeless single adults, yet only 29% of people being served in the permanent supportive housing are chronically homeless. Many living in these housing units are stable and no longer need the supports, yet due to the lack of housing, affordable housing, we can't move them to another voucher system. Our continuum of care has adopted a policy that as units in permanent supportive housing turn over, we will prioritize chronically homeless. This will help, but only if the number of affordable housing units are increased. We also heard how case management, we currently do not have case management services. To ensure those who are housed remain housed, we need to work with them. Some chronically homeless need intensive behavioral health and wraparound services in their first year. Case management can be tailored to the client's needs and can be provided through other mainstream systems, such as behavioral health, alcohol and drug, or as part of the homeless system. In addition, we have an opportunity where we could develop capacity for landlord recruitment and housing locator services. The high cost of housing in our county makes it difficult to locate affordable units. Experience in other communities and many of our neighboring counties suggest that this problem can be helped through dedicated staffing to cultivate relationships with landlords and to help clients searching to secure housing. Your board will also be reviewing the recommendations from the Measure A Subcommittee later today. Here's just a list of some of the items that, based on the information we received this morning, we would recommend be moved forward. In terms of next steps, on Thursdays, as instructed by your board, we will be presenting the final report to the Hope Interagency Council at 3 o'clock. We'll ask the committee, the Interagency Council, to look at the implications and come up with recommendations on how we can redesign our system to improve and ultimately end homelessness by 2020. And then we would come back to report to this board on those recommendations and receive final instructions. I'd like to thank you for your time this morning, and I'm happy to answer any questions if you have any. Megan will also.
Supervisor Tissier.
I have a quick question on that one slide that says cost per permanent housing exit. It goes from, for the family households and transitional housing, it shows it's about $18,000 to get them into housing. And then if you go down to rapid rehousing, it's $4,100. So I guess my question, you talk about with rapid rehousing, if I understood it correctly, that the case management comes after. You quickly get them into permanent housing and then do the case management. So the cost here of well, it's almost $4,200. Does that include the cost of case management as well?
Yes, it does.
Oh, it does, okay. Because I was going to say, does it compare, because the transitional does the case management first and then transitions you into permanent housing. So both of them have that cost embedded.
Yes, and
Okay.
when we actually collected the budget information, we worked with the county staff, HSA staff, and also all of the provider agencies to make sure that all of the information was truly apples to apples.
Okay, that's good.
Just make a couple comments. Thanks for the presentation. I just noticed that Wendy Goldberg is in the back, and she is also retiring, so we will probably honoring her in a couple of weeks as well. Sorry to see Wendy go, but she's been a leader on the issue of homelessness for the HSA department. One of the other comments I want to make, I've talked to a number of different agencies in the county, the BHRS, and looking at things like some of their client base, and if they looked at, they have about 400 chronically homeless people in the health system. Actually, it's more than that. It's actually 4,900. They're not chronic. They're not homeless all year round necessarily, but they took a look at 400, and they found that of that 400, 143 have over 10 emergency visits annually, and of the top person had 70 ER visits, or actually admissions, over a year, and I think the next person was somewhere in the neighborhood of about 40. So it looks like if you looked at this in terms of chronic homelessness, if we did a cost-benefit analysis, it looks like we would be saving a lot of emergency room time, money, and probably is cost-benefit to actually get people into rapid rehousing. And I do know that you don't do the case management and the substance abuse and the mental health treatment first, because that doesn't get them into housing. You get them into housing first and do all the case management afterwards. It's just, we've worked a lot through the HOPE plan with Envision Shelter Network, and one of the things that they have found is that they can get people back on their feet, find them a job, but then for housing, we are actually sending people to the East Bay. That is, I guess if you call it kind of an unfortunate thing, is that people who are, if they're fortunate enough to work for a chain organization of some sort like Kmart or something, they get themselves transferred and go over to the East Bay where there is housing. So, and then last of the hot teams have been really very effective. In San Mateo, South San Francisco, and of course on the coast side as well. So this is, I think this is one of the goals that our county manager, I think, wisely set up for us to end homelessness by, 2020? And I think we can do it. So thanks for the report.
Supervisor Pine?
I'll start with a couple of comments, and I did have a few questions. First off, I think the presentation was really terrific. I mean, your use of data here and real analysis of what we're doing, what's cost effective, I think is really unparalleled. As we get better and better at collecting data, I think these sort of presentations will be useful in a lot of the things we do. But this is the first, I think the real use of our data in a really, really productive way. I just want to share a couple reflections on a recent visit to South San Francisco. I've been spending a fair amount of time on the homeless issue there. They have 20 encampments, and this is kind of thick, but you can take a look at these pictures. Homelessness is so difficult because it's this lose-lose situation. The people on the street are in this terrible, terrible situation, and then the communities themselves are really impacted too. And South City is, being very aggressive and trying to clean up these 20 sites, but it just really points out how incredibly difficult this is. Adding to Supervisor Horsley's point, though, the HUT team in South City has really made a big difference, and I think our expenditure in that area will really continue to be helpful. Just a couple of case studies. Marcus A., homeless for 20 years, placed in permanent housing in Brisbane. Josh, he's the case manager, worked with Marcus to get him accepted in the Golden Gate Regional Center, obtained housing for the rest of his life. Michelle, known as the Cat Lady, homeless for at least 12 years in South San Francisco. Michelle's health had been steadily declining, and she recently started having to use a wheelchair. She refused medical treatment, even refused inheritance. Recently, Michelle's health deteriorated even more, so she was placed on a 5150, but somehow Michelle, through the HUT program, has now been taken care of, permanently housed in Belmont. So, these are like major victories. So a shout out for the HUT program. And I think it's one that we need to expand. It's really proven. Couple other points. Talked about that. Oh, You know, the other thing that came across in a recent HUT meeting, and I think you spoke to this, and I think Wendy Goldberg made the point that never in the history of the county have so many people had vouchers that they can't use. And, you know, I don't know what to do about that. I think some of them are restricted by federal law, but it kind of ties into this, of course, the housing crisis. Because, you know, unlike, you know, it's really, really hard for us to put someplace and find a home for someone, voucher or no voucher. And then my last comment before I move to some questions is, you know, I'm really proud of the work the county has done over the years to, you know, virtually eliminate homelessness for families and children. But, you know, this presentation shows there's still some remnants of that. And, you know, I would hope we could, you know, bring that to an end, like, very quickly. I'm sure those are very challenging cases because we have done a good job with motel vouchers and, you know, maybe the best job in the state. But, you know, one kid homeless is, you know, way too many. All right, so just a couple quick questions. And, again, great report. You know, I think it might be interesting to understand at some point, you know, kind of how much money we do to spend on the homelessness problem. I mean, I think, Eliana, you mentioned today that, you know, the county puts in $6 million and HUD puts in 7.5, and that's 13.5. But I'm sure there's all kinds of other costs. Anyway, I guess I can talk to you about that offline. You know, how much is it costing, and you're on it. How do we use those resources? And you know, the one question that I've really been thinking about a lot, and maybe you have a feeling for this right now, is a lot of the folks in these pictures that I just showed you. You know, they don't want to go into these shelters. They're really intractable. So we have this Josh out there who, you know, magically can get to a couple of them. But a lot of the people in those pictures I showed my colleagues of people sleeping outside and such, you know, they don't, you know, there's this, I don't know what the word is, but they don't want to go in. They have mental health problems. They have substance abuse problems. They don't want to do what's right for themselves. They don't want to do what's right for the community. So when you look at this homeless population, how many people are like that? You know, because if there are people that, you know, want shelter, I would think we could find a way to get it to them. But I don't know what to do with these folks who, you know, because of their conditions, reject these programs. You know, so how many of the, you know, what percentage of the folks out there on the street are in this category of, hey, I don't want your voucher, I don't want your shelter.
Through the president, of course, as the HOT teams expand, we're starting to gather that information. There are some individuals that, of course, refuse treatment, but the objective of the HOT team is to build that relationship and that trust so that they may accept the services. Some of them have mental health issues, and until you start building that relationship, I don't think you can get them to a point where they can readily accept the help. The other thing of ending homelessness, I don't think we'll ever get to zero, but if we can agree that the definition is that every individual who wants a place has a place, that's the objective.
Yeah, again, I was just trying to get a sense for, you know, of the unsheltered folks, you know, how many do you think are in this resistance category? You know, half of them, 20% of them? In other words, you know, how many people are unsheltered that would go somewhere if they had a place to go?
We just concluded the point-in-time surveys, the one-day count surveys, and let us go back and take a look. We expanded the survey and see if that information was captured, and we can report back to the supervisor.
Okay, and the last thing, I'm still a little confused about the rapid rehousing, in that I'm not quite sure how much of it we do, and if we do it, how we do it, since there's so few places to rent. So what is the state of rapid rehousing today?
We were surprised also, but some of our partners are providing some rapid rehousing. Some of it is with families and others with veterans. So you have the advent of having Menlo Park helps. The other is it's occurring, some are placed in county, others are placed outside of our county. And that's something, it's all voluntary. But some people decide so that they can improve their way of life or the quality of life, they'll accept an opportunity to reside outside the county, and their money may go a little further.
Thank you again. Really, very, very good presentation.
Thank you.
Through the chair, can I just make one comment about rapid rehousing? One of the things that the health plan is doing is working with an organization called Brilliant Corners.
All right.
And what Brilliant Corners is doing with the vouchers, for example, you know, one of the reasons that people don't want to take the vouchers is because there's a ton of paperwork. Brilliant Corners handles the paperwork. That's one thing. And the other is that they make assurances to the landlord that they won't get stuck, basically. So they make sure that there'll be case management, and they're not going to end up with a problem with eviction. So it's two things. It's taking care of the landlord and taking care of the paperwork, and that's actually working fairly well with the Brilliant Corners. They're using the health plan as essentially targeted about 300 cases, and so far they've rehoused 53, and they're only just begun. So that's one way to deal with it.
Supervisor Slocum?
Thank you. Thank you for the report. Thank you for the data. I'm really pleased, as one of the supervisors said, that we embarked upon this data analysis. I really would encourage us to do this sort of approach in other programmatic areas, because I think it yields some very eye-opening information. So thank you for Ileana and to Focus Strategies for the good report and the good work. Just have a couple of questions, if I could. Curious to just have a little bit of clarification about when you said many non-homeless people are entering the system. Could you just help me understand that a little bit more?
These are individuals who may be housed. They may be sharing an apartment. They may be with relatives. They may be in an apartment or in a house situation that they need just some support to stay where they're housed. Our system, basically, it's if you're near eviction, then you get the rental assistance, or you come into the homelessness situation, into our shelter network, then to be placed ultimately. So to some extent, we're encouraging or promoting the homelessness, increasing our numbers. If you can stop them by helping them, one individual in the survey was employed. He had a medical issue, which had a loss of wages. His medical issue has been now stabilized, and with some assistance in employment services, he can get housing and stay housed. Maybe we want to help them stay in the location they have and help them with employment services. So you give them a little subsidy. You don't bring them into our shelter programs. That's what we're talking about, diversion. Those individuals who, through a health issue, may be missing rent or have fallen behind. If you can keep them housed, by all means, keep them housed, and let's deal with those individuals who are chronically homeless or have behavioral health issues.
Okay, thank you. Just a couple more points, Madam President. On the topic of rapid rehousing, I know I heard what Supervisor Horsley just talked about with Brilliant Corners, and know, being on HOPE with the supervisor, know a little bit about Kate's, forgot her last name, Foster maybe? Bristol's work on rapid rehousing and her presentations to the HOPE group. But I'm curious, given the housing situation here, and you briefly touched on this, is there any literature, academic literature, that talks about rapid rehousing in situations maybe similar to San Mateo County, where housing is such a big issue? In other words, is rapid rehousing sort of an idea that might work in Utah or Sacramento, where there's lots of vacant land, lots of building, and lots of expansion going on, versus a county like San Mateo that's built out and that really, as we'll find out more this afternoon, has an affordable housing issue. So I guess the question in its simplest form is rapid rehousing really an appropriate model for here? I realize it's a sensitive question and all of that, but just would like to hear your response about that.
I'll let the expert.
Yeah, thank you.
I like the way you ended that. The simplest answer is, well, you are doing it and it's working. and people aren't returning to homelessness. You know, the homeless systems in general are currently organized based on logic, which sounds kind of good, but it turns out a lot of our data doesn't reflect what we would logically conclude. So as a matter of fact, places with very tight rental markets and very, very high rents actually see the same level of success in rapid rehousing as other communities. And generally, and that's based on the national results from the HUD-funded program, HPRP. I'm still going to come up with what that means, what that stands for, and I can't believe that. And also from various program evaluations across the country. There is not academic research on this program model at this point, looking at results. But we can say that, and this is more of our just experience working with different kinds of clients, different kinds of communities and states, that what we find is that the results are the same, but some of the strategies seem to be different. So in a place like San Mateo County, you're likely to see more people getting roommates, renting rooms, moving out of county, having more creative kinds of strategies. The other thing that I think is important to understand about homelessness is that actually the difference between extremely low income people and homeless people is virtually none. The two populations are essentially indistinguishable. So what happens is that some people who are extremely low income actually do fall into homelessness, most don't. Once you've rehoused people who did fall into homelessness, they're again indistinguishable and generally never become homeless again. You know, you saw those really high rates of success and very relatively low rates of return to homelessness. So it does seem like the evidence suggests very strongly that really the end game is you get people into permanent housing and then they don't return. They find ways to make it as other extremely low income households do.
Thank you. Just one last question, if I could, is maybe for Ileana and maybe the county manager and maybe Selena. I'm not sure, but one of the things we're going to do at the HOPE meeting, I understand, on Thursday, is we're going to have this presentation. We're going to talk about system redesign, and I'm curious about the process that we'll use for that system redesign. Will staff be involved? Is it the HOPE committee only? Is it a bigger group? Or have you really given that thought at this point in time?
I think we are at the infancy of how that will look, but that we break out into work groups in certain areas based on the composition of our HOPE IAC. We've certainly encouraged other members at the direction of this board to join so that we can have expertise around the table from various arenas and then come back with, as a group, on the recommendations, a dialogue, and for discussion on what we bring forward to the board for recommendations.
Thank you.
Just a couple quick questions. You talked about surveys and getting information, data, and all that. Do we know how many landlords actually accept vouchers?
No, I don't. That may be a question for Mr. Lowell in the afternoon.
I mean, this may be something for this afternoon, because I had some thoughts, because I'd also like to know, and I don't know if we know this either, is how many landlords used to but no longer do. Because I called around for trying to help this young lady a couple months ago, and I called some of the apartment owners that I knew in the North County, and I knew they took Section 8 housing vouchers, but they don't anymore. And I'm sort of curious, you know, none of them want rent stabilization, but then they also don't want to participate by continuing to have some units available. So I guess what I'm going to hope for this afternoon is if we have that information, then two, what kind of incentives can we provide to landlords? And you mentioned the fact that we can make some decisions on, you know, helping them should they get an unruly individual or something like that. But it would be helpful to know those statistics if we can possibly find that out, because I think everybody needs, if we're going to change things, everybody needs to be a part of it. Otherwise, that's the reason people want us to do rent control and things, which I mentioned I wasn't a big fan of. But, you know, some individuals are actually causing the problem on their own because they're not doing it anymore. And I think that's unfortunate.
Ileana, thank you. We have one speaker card Martin Fox.
Good morning again, President Groom and members of the board. Again, thank you for your service to the county. I agree that strategies to serve the mortally homeless people need to be considered. However, I also believe simply housing the homeless does not end homelessness, and in fact, without treatment, they become locked in a broken system of warehousing without healing. That reminds me of reading a letter to the editor of the San Francisco Daily Journal last month, written in response to an article about a point-in-time survey conducted in another county. Los Angeles County Supervisor Michael Antonovich admonished the author of the homeless survey article for failing to acknowledge that mental illness is the primary cause of homelessness in his letter to the editor of the San Francisco Daily Journal, and I agree. I also agree with him that simply housing the homeless does not end their homelessness, and in fact, without treatment, they become locked into the broken system of warehousing without healing. Treatment that addresses mental illness is vital to address the root cause of homelessness. Supervisor Antonovich goes on to point out that the 1967 Landerman Peaches Short Act is an antiquated law that makes it practically impossible for judges, families, and physicians to compel severely mentally ill persons to accept treatment and medication. He says that Laura's Law is a critical first step in addressing a flawed system, and LA County's Laura's Law pilot project has shown tremendous success after just 5 years, and that is why they have voted for full implementation of Laura's Law unanimously. Please take the first critical steps to address the root cause of homelessness in San Mateo County by voting to implement Laura's Law and starting to reform our broken mental health laws. Thank you.
Thank you. Do you have any last thoughts or comments for Ms. Rodriguez and our consultant? Okay, so we will discuss this issue at much greater length this afternoon at 1:30 when we're having an affordable housing workshop. Thank you. Now, our regular item, we begin with the Public Works Department.
Thank you, President Groom, members of the board, Ms. Ferralis, Mr. Malpe, and Mr. Byers. I am reporting back on an update on Alpine Trail and reaffirming the board's action the last time we met on this project. So just to refresh your memory, excuse me, this project involves rehabilitating close to 2 miles, it's 1.84 miles, of existing trail that runs along Alpine Road between Portola Valley and Menlo Park in the unincorporated section. The board directed staff to come back and essentially put the trail back in its existing alignment and width. The only exceptions that we'll make on that is to provide widening in sections where we need to comply with ADA, as well as realign the trail in some sections to move it away from trees. Also part of this project is to provide bank stabilization at 3 sites along Los Trancos Creek. Site 1 is up near Portola Valley. We'd suggested a block wall there. Site 2 is actually south of I-280, and that was to be a 80-foot long soldier pile wall. And Site 3, which is just north of I-280, was to be a 70-foot long cast-in-place concrete wall. Our recommendations or our design at that time was based on building this project within the county right-of-way. So we were trying to stay within the easement that the county has along Alpine Road. This will kind of refresh your memory on why we're doing this. The creek itself, Los Trancos, is cut into the side of the roadway to a point where we're getting concerned about losing the trail and the road itself. There's also utilities that are running along Alpine Road that need to be protected. So if we fast forward to January 28th, Stanford University was at the meeting and suggested that we could come up with another alternative that used their land. So the board directed us to meet with Stanford, which we did, and we came back on March 11th and were directed to work with Stanford in more detail on finding what kind of alternative designs we could come up with to provide a more environmentally friendly project recognizing that we may be required to use Stanford land to get that done. So we met with Stanford, came back to the board in November, and we provided a project that would modify essentially sites 2 and 3. Those modifications included installing a live log crib wall in front of the soldier pile wall at site 2. And at site 3, our suggestion was to actually move the creek 75 feet, build up earth along Alpine Road to stabilize it, and also construct a live log crib wall. We were also authorized by your board to revise and recirculate the ISM&D. On January 27th, we came back to your board recently to authorize an agreement with ESA, Environmental Services Agency, to extend their term and also increase the maximum not to exceed. So we've also met with regulatory agencies out in the field. And although we notified all the permitting agencies, 3 showed up. We're still continuing our outreach with the regulatory agencies, but a meeting was held out in the field on the 15th, and the feedback we got from the regulatory agencies was, Site 2, they liked the idea of a live log crib wall. At Site 3, they preferred that the creek not be moved 75 feet. They felt that the impact to the environment was greater by relocating the creek that greater distance than it would be for us to actually relocate at a shorter distance, which is going to be somewhere around 15 feet, and try to minimize the damage to that, to the overall damage that we would cause during construction to the environment.
Hey, Jim, was Stanford there?
Stanford was
it
at
was
the
their
meeting.
idea to do the 75 feet.
Pardon me?
As I recall, it was their idea to move the creek 75 feet. So was Stanford there, and they heard from the environmental agencies that
That's
that was
correct.
not? Okay, good.
Yes, Stanford was at that meeting. So based on feedback from the agencies, we're coming back with a somewhat revised proposal at Site 3, and that is to do exactly what we said, which is shift the creek over less than 75 feet, but also include the concrete retaining wall. And the reason why we need that is to hold up Alpine Road, essentially. There are utilities in that road. The problem is if we shift the creek only 15 to 20 feet, the soil buttress that we would put in against that road simply doesn't have the strength to hold that road up. So that's why we're coming back with a retaining wall. Just to refresh your memory on what a live log crib wall is, it's basically you take live logs and you build it into a box. And you fill that box with soil, and you plant in vegetation that will grow in the riverine environment. And over time, those logs decay, and the vegetation takes over, so you get a more natural setting. And this is an example of the construction. You've seen these pictures before, so I'll work through them pretty quickly. But you end up getting a more natural feeling, and nature runs its course, and it provides through the vegetation stabilization along the bank. This is a depiction of what Site 2 will look like. We will build our soldier pile wall and build a live log crib wall in front of it. On Site 3, we're going to build a cast-in-place concrete retaining wall and build the live log crib wall in front of that. So we'll be modifying our overall recommendation in that manner. In terms of budget, we started this project at about $1.4 million. With these changes, the project will be somewhere around $2.725 million. Of course, those numbers will change based upon the bids we receive, but that is the latest estimate we've gotten from our engineers and environmental consultants. And with that, I would be happy to answer questions.
Questions? No? Okay, I don't have any speaker cards. So what's your pleasure?
I move approval of to authorize the agreement with the BKF engineers and also to authorize the Department of Public Works to proceed with the alternative recommendations for bank stabilization measures at Site 3.
And I'll second that.
Okay. Do we need a roll call? Okay, all in favor?
Aye.
Aye. Thanks, Mr. Porter. Now we'll go to the Sheriff Monk's item number 6.
Good morning, President Groom, honorable board members. I'm bringing this item back. I've actually asked the undersheriff to present it since he did all the work on it along with Captain John Quinlan, and we were talking about retirements, and I would just like to note that Captain Quinlan is retiring in a couple weeks, and I'll have an opportunity to say some nice things about him later, but just want to publicly acknowledge and thank him for the work he did on this item as well as many other items, and I'd ask the undersheriff to come up and present this item, please.
Thank you, Sheriff Monks. Good morning, President Groom, board members, Mr. Malpe and Mr. Byers. I'm Under Sheriff Carlos Bolanos, and to bring us up to date, in 1999, the Board of Supervisors adopted an ordinance prohibiting the county and county law enforcement officials from selling any county-owned firearm. The only current exception to the prohibition allows for the sale of firearms to another law enforcement agency. We are before the board today requesting an amendment to the ordinance which would allow the sheriff's office to sell old duty weapons to interested sworn personnel who meet the following criteria: holding the rank of deputy sheriff or above, currently employed by the sheriff's office, at fair market value through a licensed firearm dealer in accordance with applicable state and federal law. Employees participating in this program would be required to sign an agreement that they will not resell the weapons. We have determined the fair market value of the weapons to be $125 per weapon, plus a transfer fee. And as your board knows, the sheriff's office has recently purchased replacement firearms to replace these outdated firearms. So at this point, thank you for your time. I would be happy to answer any questions you may have.
Anyone with questions?
I just had one on, I guess by law, we have to, the weapons have to go to this third party, I don't know what they're called.
Federal Firearms, it's FFL, Federal Firearms Dealer.
Yeah. So I assume we have to compensate them somehow, right? For
The cost for that process is $35, and our expectation is that employees wishing to participate in this program will pay that fee.
In addition to the 100, or is that part of the 100?
In addition to the 125.
Okay.
I was going to move approval of the ordinance amending Section 3.52.200 of Chapter 3.52 of San Mateo County Ordinance Code.
Second.
Mr. Byers, would you? All in favor?
Aye.
Aye.
Thanks.
Thank you.
Item number 7 is the county manager's report.
Madam President, members of the board, this morning my report focuses on just a few items. The first, as the board is aware, the governor has determined that the damages that were caused by the November 30th storm incident in San Mateo County can be handled within the financial means of the county, and therefore a continuing declaration of emergency is no longer required. That does mean that we will not qualify for some, not all, but some federal or state funds, but we are continuing discussions with the governor's office regarding that, but I don't see that changing at this time. With respect to North Fair Oaks, I'm pleased to report that signs have been selected for the 4 entrances to North Fair Oaks that were designed through a community participation process by a local artist. They're really quite unique and will be installed shortly. The Take a Hike season in parks is now underway, and as the board knows, having participated in various events in the past, this particular series of hikes in our parks is not only intended to introduce some who may not be familiar with our parks and our trail system to the extensive open space that is under our stewardship in the county, but also gives volunteers the opportunity to be part of that process and gain additional support for our park system. With respect to our performance, the county social media reports that the county now has over 1,800 Facebook fans, and our Twitter followers are approaching 1,000, and the Friends of the County Manager now 2. So,
His grandchildren.
well, one of them dropped out, so that's why it's down to 2. Finally, in other events, more than 60 representatives of the community-based organizations met on March 9th to learn various aspects of evidence-based practices and how they apply to funding. The half-day workshop prepared the participants to apply for over $1 million in public safety realignment grant dollars in fiscal year 15-16 through the Community Corrections Partnership with targeted services like supportive transitional housing, transportation, employment, and other innovative and promising programs. If the board has any questions or comments, I'll be happy to entertain them.
Questions, comments? Thank you. Now we'll go to the Measure A Subcommittee report. And before we do that, I want to thank Supervisor Slocum, Supervisor Tissier for agreeing to take that work on. And it looks like in the reduced size of the report, you guys did an excellent job. So
We were trying to get down to 2 pages, but I think it ended up being maybe 4 or 5. But
So,
we still have time.
would you like to begin? Or is Ms. Farrell going to?
Ms. Farrells actually was
Okay.
going to present it, but I do want to say that Raina and her crew have done a tremendous job, which this is a very difficult process of trying to pare this down to really some key areas that we want to address, and at the same time still leaving some wiggle room for requests for proposals. And then we also, it's not in here as much, but we did talk about our own budget, and there are things that would naturally fall into our budget. So, you know, it's still kind of a work in progress, but I think we've really gotten it down to a real manageable size. And Raina, I want to thank you for kind of corralling Warren and I and getting us to focus specifically and getting it something reasonable for all of us to digest. So thank you.
All right, good morning, Madam President, members of the board, members of the Measure A Subcommittee. We're pleased to present to you this morning the recommendations. And the major differences from the February 10th version are really in 3 areas. So number 1, we narrowed down the priorities some more. So in the report, we have specific initiatives that we want to move forward to the application phase in the areas of homelessness and housing support. And those recommendations were in the slide presentation today from Ms. Rodriguez. Also, initiatives in the areas of foster youth and at-risk youth, as well as older adults. So those are our top 3 recommendations for Measure A funding. And then in addition to that, on non-Measure A funding, we're also taking a look at funding sustainability initiatives that will be prioritized by the Office of Sustainability. We're looking to fund dental services from the health system and from other sources. And then also looking at domestic violence, the gun compliance program, and one diversion program from the San Mateo Police Activities League. So we'll look at other funding for those particular initiatives. And then the third area is the creation of funding for board-specific initiatives. And these are for needs in the different districts. And we are recommending the creation of one-time loans and grants fund. That's $5 million, so $1 million per board district. And then another fund for $200,000 per year for each board district, so $1 million in total for each fiscal year for the next 2 years. So that would be a separate process, and we would start with the letters of intent that were not funded as part of this round. So that's an overview of where we're currently at with the recommendations of the subcommittee. I do want to thank both board members for their their patience as well with this process and helping us through to this point.
Okay, I have 2 speaker cards, so we'll go to those first. It's all right with all of you? Jay Watson?
Well, good morning, and thank you, members of the board and county staff. My name is Jay Watson. I'm the Regional Vice President for the Student Conservation Association. We're a national youth serving organization and a partner of San Mateo County Parks. And I would just like to say we've obviously been participating in the process, and I think it's been run efficiently. There's an awful lot at stake, a large amount of money, so you've been appropriately, deliberative and set up the subcommittee, but at the same time, it's been, you've notified the public and kept us current of where the process is at, and with information on the website, it's just been very much appreciated. We are a partner of San Mateo County Parks for the last 5 or 6 years, and are a potential grantee, I guess is the right term, under Measure A funding, and we're looking very forward to expanding our partnership with San Mateo County Parks. It's a tremendous agency that we work with, and under the leadership of Marlene and Scott Lombardi and Ramona Rechiga, who we work with very closely on a GIS project. It's a very rewarding partnership with us, and we look forward to an expansion of that and serving more youth in the county. And it's also providing us very important leverage to bring other private monies that we raise to the table on that partnership. So thank you.
Thank you, Mr. Watson. Martin Fox?
Good morning again, President Groom and members of the board. Thank you for your service to the county. I want to thank the county manager for bringing the question of continuing or modifying the performance measures of existing initiatives back to the board on April 28th. At that time, I would appreciate it if you'd please include the mental health system of care for adults performance measures that identify the number of mentally ill people who enter and complete treatment after being transported to the mental health respite center, after an expanded SMART encounter, and after undergoing an early review following being booked into jail. The creation of a mental health respite center and the expansion of SMART and the early review for jail alternative dispositions were identified in the county manager's July 11, 2013 report back memo. The Measure A Oversight Committee annual report included recommended measures, and you can look in the first page of attachment B. However, the respite center measures were omitted. Untreated mental illness is a long-term problem that needs long-term solutions and measures that reflect a significant amount of time and effort. Expecting meaningful results after 72 hours, 14 days, 30 days is one of the reasons why the Landerman-Petrus Short Act is ineffective, immoral, and inhumane and should be repealed. Please include the mental health system of care for adults performance measures that identify the number of mentally ill people who enter and complete treatment after being transported to the respite center, an expanded SMART encounter, or undergoing early review following being booked into jail. Thank you.
Thank you, Mr. Fox. Any other speaker cards? Okay. Supervisor Slocum.
Supervisor Tissier thanked Raina and staff, but I just want to give a special shout out to Jim Sacco and the entire budget team, I think many of whom are here in the room. I don't know how many times you all had to re-crunch those numbers, and that spreadsheet kept getting thicker and thicker. And certainly you put in a lot of hours, I'm sure a lot of overtime, and your work. Every time we met, I know it generated a lot more work for you all, and it's just recognized, valued, and appreciated. So thank you for everything that you all brought to the process.
It was really Warren that required all that extra paperwork. It really wasn't.
Oh, financial questions.
Supervisor Pine?
I too want to thank the subcommittee. This really came back in a very digestible form, and it really shows a lot of good thinking that was done. And I know my colleagues we actually went out and visited some of the programs as well, and everyone is the staff that's been mentioned, and this is a lot of work. So, I think we have something that's, holds together. There's no perfect way to do this, given the number of submissions and all the needs that we could address. But, I think we came out in a good spot. Thinking way ahead to when we do this the next time, I think we might maybe start as a year early, maybe even a year early, so that we can, I still think there's a place to think about. There'll be, 6 more years of Measure A. So, there'll be still many $600 million or something. So, when you look at it kind of in that perspective, we probably should start earlier, just, to really brainstorm about the process generally. But, I think we came out well here in large part, and because the subcommittee and the staff have helped a great deal.
Supervisor Horsley.
I just want to also thank the staff. I think this is not an easy process of putting all these competing ideas together, and I think they did a great job. And I really want to thank the subcommittee. You actually put together, I think, was really a very good program, and I just know how difficult this was. And I thought it was done in a very thoughtful and methodical manner, and I appreciate the work that both of you did.
Okay, so I'd like to add my thanks also, and I think that we hit on exactly the right categories and worked out, and we obviously have a lot of people who submitted requests, and I think that we've solved a little bit of that by having this RFP process and dividing things up into sort of buckets where we can deal with them in a more manageable way. And I kind of agree with Dave. I think perhaps the other thing I'd like to suggest when we begin this process again is that we do have just one workshop only on priorities. And maybe really kind of get deep into what we think we really want to focus on, because I think there's so many things that we all care about, and there's so many needs for certain folks in our county, and I think sometimes we want to do everything at one time, and we've learned that we just can't. So that would be my suggestion. And with that, how about a motion to accept?
I'll make the motion to accept the subcommittee's recommendation. Second.
Okay, all in favor?
Aye.
Aye. Thank you very much again, Adrian and Warren, and to the staff. Great work as always. So now, Supervisor Slocum, this is your item.
Thank you, Madam President. Today, we're going to hear a brief presentation from the California Department of Motor Vehicles regarding the implementation of Assembly Bill 60. And you'll remember that Assembly Bill 60 was signed into law by Governor Brown in October of 2013, and it basically granted driver's licenses to anyone 16 years of age and over, regardless of immigration status. And that law took effect on January 1st, 2015. Before I introduce our representatives from the DMV, let me just invite you once again to getting a legal driver's license workshop that the DMV graciously volunteered to conduct here in San Mateo County. I understand we're the last stop in California for this seminar, and we appreciate you being here. But it's tonight at 7 o'clock at the Fair Oaks Community Center, which is located at 2600 Middlefield Road. And as I said, it starts at 7 and ends at 8:30. Our two very distinguished representatives from the California Department of Motor Vehicles are first Mike McGowan, who is the Deputy Director of Strategic Planning and Policy at the DMV. And I just should warn you all before he speaks that he is a former member of the Yolo County Board of Supervisors.
Oh.
So welcome to Mr. McGowan.
Could I toss in that he's also past president of CSAC?
Yes, you could do that. He's also a lawyer and has many credentials, a member of the Yolo County Transportation District Board of Directors, the Delta Protection Commission, and the Veterans of Foreign Wars. Welcome, Mike. And second, let me introduce to you Lizette Mata, who is the Deputy Director of Special Projects for the DMV of California. And previously, she served as Communications Director at the California Assembly Pro Tem's office. She was Committee Secretary for the California State Assembly Committee on Veterans Affairs, and has held multiple positions, I believe, in Sacramento. So welcome to you both, and Supervisor, I would turn the floor over to you.
Thank you very much. Thank you for your invitation, and we do appreciate this opportunity to briefly just highlight today to your board, certainly answer any questions if you may have them. Just a few of the points about the new law, AB 60, but as you've already indicated, also to highlight the fact that we will be hosting or participating in a hosted seminar this evening, hosted by yourself, and here in San Mateo County, and Lizette will be running that show. It's if you're going to be there, you'll be real impressed with the way she delivers this to the folks, and hopefully it's going to be very useful and something that they will be able to take and then go get their license. So yes, this is actually this isn't new. Up until about the mid-90s, there was a period of time when we did not check in the state of California for your citizenship, and you may remember a time during some political heated times where we clamped down on those issues, and about 1994, 95, the requirement to have legal status, either citizenship or a legal presence established, was required to get a license. And so we're kind of going back in time in a way. So AB 60 allows immigrants here who do not have proof of legal presence to nonetheless get a license. However, those folks are still required to be able to adequately supply identification. They have to identify themselves, and they have to have proof of residency. And I will just say that from my relatively short but clear experience from the DMV is we are emphatic, almost maniacal about this question of establishing your true identity. We do that now with what we call legacy licenses, those of us who do have citizenship or legal presence, and we also do that with this new population. The identification required is rather strict and strenuous, to the point that since the first of the year we have issued about 130,000 licenses under AB 60. But we've had almost 400,000 people go through the process, and so it's, as you can see, it's not automatic. It does require the individuals to prove identification, proof of residency, but they also must comply with all of the other requirements that anybody else would have to comply with. That is, they must pass a knowledge test, they must pass the written test. There is a physical requirement as well. They have to be able to read the eye chart and demonstrate that they physically are able to, and take the drive test. And when they take their drive test, they must do so in a vehicle that has proof of insurance. The whole concept behind this was to improve public safety. Yes, the governor, in the governor's statement, he did say that we were also taking some folks out of the shadows. But first and foremost, we're I think, attempting to legitimize the driving process for more and more Californians, and actually be able to regulate them in a more effective and efficient manner. We estimate there's about 1.5 million people who are eligible for this license, and that was going into the process. We suspect there's more than that. To prepare for this new population, we were given authorization and funding for 1,000 new DMV employees. We were also given funds to open up 4 specific new large boxes, driver's license processing centers, one in San Jose, where all they do is handle a first-time new driver's license, whether that's a regular or AB 60. So we're trying to do everything we can to be prepared for that, and hopefully by summertime or so, we'll have sorted out all the kinks, and we'll be clicking along real smoothly. As part of our process, Lizette has been very involved. She's basically been the outreach person for the DMV. And it's kind of a new situation because we've done this really without any real funding or any real big process. But Lizette has either personally presented or overseen over 200 outreach events throughout the state of California since about a year ago, and has come in contact with about 75,000 people. And as you'll probably see or hear about from tonight, that it'll be a very attentive and interested audience, because these folks are very concerned about what they have to do to be able to get this new license. So I think that's about it. I'm the presenter today, but tonight will be Lizette's show, and hopefully it'll be a very productive one. So we want to thank you again for letting us stop by and just introduce this topic to you again, and thanks again for creating and setting up the outreach event for this evening.
Thank you.
Thank you both, and we'll look forward to seeing you tonight.
Our pleasure.
Thank you very much.
Thank you, Supervisor Slocum. So now we will go to board member reports. Would you like to start, Supervisor Pine?
No report today, but I will do want to acknowledge again Supervisor Slocum. I think it was just a fantastic idea to get some training down to people about this new program.
Thank you.
I may have to steal that idea.
Okay,
All right.
it's a deal. Thank you.
Supervisor
No report.
Slocum?
I just going to also commend Supervisor Slocum on that, because, you know, this is, having a driver's license will take away a major source of contention between residents and law enforcement. I don't know if you know this, but when an officer stops somebody in a traffic violation, they don't have a license, the car gets impounded. And, you know, there was a few years back when Redwood City was doing, you know, a DUI checkpoint, and they ended up taking away a lot of cars. They ended up with a tremendous amount of resentment in the community. So this is an important thing, and I commend you for doing that. I don't have any other report except that I've gone on some of the Take a Heights with that are sponsored by Supervisor Groom, and we had a great time over Flood Park, and then most recently went over to Fitzgerald Marine Reserve and got to go into the house by John Miller's house and see his Ford Frick Award for being, you know, the Hall of Fame for being an announcer. So didn't get to meet him, unfortunately, but got to go in his house.
You know, I could add to that. We just had a wonderful time at Flood Park.
It was great.
And it's nice and flat, so it's no big exertion, but we learned so much history from the Rangers.
Yeah.
And so that was really a great time and at our next meeting, we'll put up the dates for the future Take a Hikes. Adrian, do you have
I do have a adjourned in memory of Richard Poblitz. He passed away peacefully at his home, surrounded by his family, his wife Susan, and his children Jamie, Paul, and Ben. He's also survived by his mother Virginia and his grandchildren Valencia and Howard. He was a plumber for more than 40 years with Local 38 and had his own plumbing business. He was a Bay Area native, and his world really revolved around his family, golfing with buddies, and service to the community, and of course rooting for the Niners. So he will be sorely missed.
I have three, and I was thinking this morning that these are all people who were very active in the community, still hard at work, and it's extra sad when young people to leave us. So the first is for Elise Stone, who's been a long time member of the League of Women Voters in San Mateo County. She's been a health educator, traveled all over the world, and her most recent career was she was the director of the California Poison Center. And so she too will be missed. And Alice Jameson, who a longtime resident of San Mateo County and in Hillsborough and in San Mateo, active member of the San Mateo County Historical Association, the Northern California Council of Alumni. She was a life member of the American Association of University Women. She operated under the mantra of never speak ill of anyone, and served a really rich life. And lastly, Carol Burgess Emmett, who died recently in Hillsborough. She was a partner at Russell Reynolds Associates, but she spent most of her career leading public health agencies, both in the state of California and the federal government, and also the San Francisco Department of Public Health. And she too will be missed by her husband and her family. And with that, we're going to adjourn to closed session.
Yeah, yes, gladly, President Groom. The board met in closed session on 2 real property matters and 1 pending lawsuit, and no final action was taken on any of those 3 items.
Okay, thank you. And we will come back at 1:30 for our affordable housing workshop.